Hello, everybody.
Charlotte Henry LPN.
Give everybody a couple more minutes to get on, and then we'll get rolling. All right, we'll give everybody another minute, and then it is on. Squares are moving fast and furiously now. Yeah, we're still a little thin. Maybe we'll go ahead and get rolling. Folks can certainly join in as they wish. So welcome, everybody. It's been a couple weeks since we got together. Hope everyone's enjoying the nicer weather now. We went from like snow to 85 degrees in like 2 weeks in the typical Rochester way. So several things to talk about today. I know the big conversation will be around vaccine and masking policy updates in New York State. So I know LJ and Kathy probably have lots to talk about with the vaccine. We'll talk a little bit about the masking policies because several folks have reached out to me with several questions about the practice, about other things in the community they're involved in. So I'll try to address all those. Whether you're heartbroken or cheering, or just because of laziness for me, I did not get a chance today because I've been running meeting to meeting to do the Excel spreadsheet update for the State of the Union. So I don't have that today. So enjoy not having to look at all those numbers that you may be tired of looking at for the last 12 months or more now. So I will say, as far as we look across the region, the Finger Lakes region remains the highest risk incidence of COVID in the entire state. So we're at about 2.8%. Depending on what data you look at, we're either just starting to trend down in Monroe County or kind of holding flat. But if you look at our southern tier region, Livingston and Allegheny in particular, followed by Wyoming, have all had an uptick that is not insignificant in the last 7 to 14 days. So the southern tier was the leader in the state at about a 0.4% rate of positivity, and is now in the last 7 days been at about 1.4%. So we're definitely still seeing percolating. I think the number was somewhere around 85, 87% of those tested are of the UK variant now. So that is by far the most prominent strain of COVID that is currently in existence in our community. However, it's been confirmed in several different venues, but again, during the command center call for U of R, that to our best knowledge and all the scientific evidence to date, the existing vaccines are covering the strains and variants that are currently circulating. So the protection is still there and it's still vibrant. So it's important for an understanding purposes. Certainly the UK strain and now the B1.117.1, which I think is what they're calling the Indian variant from India. That strain is even more transmissible than the UK strain, but we really have not seen that into any significant degree in New York State or at all in our region that I'm aware of. So it does matter for the unvaccinated group because these strains that are circulating are a bit more transmissible than the Wuhan strain that we were initially dealing with. But nonetheless, the vaccination that's currently available does seem to be effective against those strains. As far as vaccinated rates, the number who have received the first dose vaccination, I think, has now crested 64% in Monroe County. Kathy probably can speak to that better. I think that was the number if I remember correctly. But if we go down into the southern tier and into Wyoming County, we're still at or south of 50% at the moment. So we're steadily marching, but that march has been slower as we're starting to get and to incur more vaccine hesitancy with the remaining group that has not been vaccinated to date. There has been a flurry, as folks are aware, and we'll talk about soon, amongst that 12 to 15 category of folks going out and getting vaccinated. If you look at the heat map, it would appear that pretty much if you live in Brighton or Pittsford, you have been vaccinated. If you live in the southern tier or around the Pennsylvania border, you may not have heard that a vaccine exists at this moment. So it just, the penetration of the vaccine definitely gets less the farther out on the bullseye board that you get to some degree. So that's still an ongoing effort. There is effort, I know, within many of the rural counties between the health departments and the school systems, trying to get vaccinations into the school systems before the end of the school year. We are seeing an increasing number, and certainly folks on this call are testaments to it, of primary care offices that are making huge strides to vaccinating. And that has been a little bit slower in some of the rural counties, but there is interest and effort ongoing. I even spoke to one of the pharmacies down here in the southern tier region, and they're making a strong effort to try to push vaccination in some of these rural communities as well. So lots of efforts ongoing from several different venues, but still a long ways to go. The U of R group that has been doing modeling for quite some time, looking at what point would we be that we get 80% of the Finger Lakes region vaccinated with 2 doses of vaccine. Current projection at the rate that we're doing vaccinations now could extend that out into December of 2021 to reach that 80% threshold, which is a little bit longer than we were even talking about a month ago, truthfully, as the rates of vaccination have started to peter off a little bit. Testing remains very much available. There's, the CDC has approved home testing, although it is important to point out that none of those home tests are viable for New York State utilization for return to school, return to work, those kind of things. So they're there for folks who want to do the testing. And even though they are approved for use, they do not meet the criteria for all of the return to work and return to school status. remember, it's still 2 weeks off at this point. The asymptomatic testing facility, the ambulatory testing facility that's East River Road, will be moving to Sawgrass. We put that information out last week. That'll be moving at the end of this month. We're still a couple of weeks from that. So at this moment, patients should continue to go to East River Road as they have been. But as we approach that May 27th cutoff, we will have that transitional period where that asymptomatic testing will move to the Sawgrass facility on the first floor. So that's been in the handout. We'll continue to remind you as we get closer to that. But by the next time we talk, we'll be just about right on top of that transition. So I just want to point it out again today. Otherwise, I think the biggest discussion that's come out is that as of today, the governor has adopted the CDC guidelines regarding masking. And that has put everyone in a bit of a tizzy. So it is important to point out, and it is not getting communicated well in the press, and patients are certainly not reading down to that last line, but healthcare facilities are excluded from that release of masking mandate. So whether it be hospitals, physician offices, anywhere where vulnerable populations would be exposed, the masking mandates remain to this point. Now, there has been some discussion, and we are still working through the details of, can we reduce the masking requirements in small group meetings where we know that all of the attendees have been vaccinated? There is some ongoing discussion around that. I can tell you from the U of R side, there has been some concern about the potential for outing people, not being respectful of inclusion and DEI kind of considerations. So it's been a little bit of a slow process while we've been trying to process what is fair and equitable for the health of the population, but then also as we push towards a more vaccinated population and people are theoretically protected and the data is strongly in favor of these vaccines doing what we thought, that there will need to come a time where we start to back away from the stringency of some of these masking and social distancing efforts. So when does that start? So I put all that out to say, for the moment, and I can say, in the hospitals, it was universally from every one of the U of R affiliate hospitals brought up that we are starting to encounter what I'll call more belligerence or irritability on behalf of the public that are coming into the facilities that are expecting that they no longer have to mask because they're vaccinated. And when they come in and encounter, and I'm certainly hearing this from offices as well, when they encounter a roadblock or a sign that says they must mask, they are contesting that more vehemently than they even were 5-7 days ago. So it is still within the guidance that is put out by the state. But unfortunately, that is not being widely communicated. People are just communicating that New York has unmasked and moving forward with the CDC relaxation. But more and more folks have asked, for these efforts that your practices may be involved in, for community efforts that you may be involved in, what is the going plan? And pretty much across the board, if you talk to the Chamber of Commerce, if you talk to businesses in general, there's a lot of confusion and uncertainty. So many businesses are taking the honor system kind of approach that if you say that you've been vaccinated, that they're not going to stop you from unmasking in their facilities. Obviously, there's a lot of people who have a lot of discomfort about that because some of the people who have the hesitancy may be the least likely to necessarily be honest about the fact that they've been vaccinated. We all know that there's been circulating, not just rumors, but outright efforts at trying to facsimile copy the vaccine cards for proof of vaccination or kind of false proof of vaccination. So, it's not unlikely that we will see some of these honor system businesses that will have patrons who are not truly vaccinated, but who will come in unmasked and therefore could be exposing others. People have asked questions about places where young children who are not yet applicable for vaccination. What should the masking requirements be even for unvaccinated or for vaccinated in those settings? And the vaccinated could still transmit to those kids. I think we've definitely developed this very big dichotomy in the population of there are people who are vaccinated who feel very uncomfortable about unmasking and will continue to mask for the foreseeable future. I think it's very likely some degree of masking is now part of our society, and that's just the way we're going to be for quite some time, if not forever. But unfortunately, to this moment, there is no hard and fast guidance that thou shalt do this, like we saw early on in the pandemic. So some of this is going to be just best case efforts, knowing that there may not be necessarily a right way to do it. But certainly, the masking and social distancing has had the desired effect. And it's probably no small loss that as we've started to back away from that, we have seen a little bit of a resurgence in our case rate. So it's hard to prove that for certain that those two are directly related, but it's at least a interesting happenstance that that's occurring. So more to come on this. I think this is going to be a national discussion, really a global discussion over the next weeks and months ahead. Certainly with the warmer weather, if everything follows suit from what we saw last year, we would expect to see a declining incidence just as people are more outside and spreading out a little bit more anyway. But when we couple that with the unmasking efforts, what the balance of outcome will be remains to be seen to some degree. But I think it is safe to say the vaccine is available for those who want it. Sometimes you can drive down the street and there's literally vaccine clinic followed by vaccine clinic followed by vaccine hub. So you almost trip over people trying to give you the vaccine at this point. I thought about just getting a dose sometimes because they seem really adamant about wanting to give it. And Kim Povic is staring at me right now. She's always talking about giving people a vaccine. So if you're bored on a weekend and just want to get a vaccine, she'll probably give it to you, even if you've had 2 or 3 doses so far. So I say all that to say, those who are starting to become less hesitant, and especially those who see vaccine as a way to get to unmasking, we are starting to see, even in the hospitals, some of that population that is starting to seek out vaccine. But I remain surprised that there are many of those people who have been so detached from the vaccination effort that they now don't seem to know how to get themselves in to get vaccinated. So we are starting to see people reconsideration. I want to get vaccinated, but I don't know where to go. So if you start to get those folks in your practice, knowing that there were still folks in many practices who had opted to at least wait, if not who had outright decided not to be vaccinated before, there is going to be that opportunity, and it is plentiful, and you can almost get vaccinated, if not the same day, certainly within probably 24 to 48 hours, if you so choose in this community right now, especially if you're willing to drive more than a football field. You will probably pass a vaccination site at some point. So that's good news. It is available, and hopefully in the communities where we need it most already. With that, I think I've covered most of my stuff. I was going to hand it to LJ to lead the rest of the vaccine discussion, especially in the younger populations.
Thanks, Chad. I appreciate that. I want to insert one other topic before we focus on vaccines. A number of our pediatricians and family physicians have been reaching out about the significant increase in kids now coming in with colds, with gastrointestinal illnesses, with, some of this could be allergy symptoms too, but really a lot more viral illnesses, likely a result of the fact that others are unmasking around them, so we're actually seeing more normal volume of illness. And so the question has come up from a number of different sources: is there going to be a change in the screening guidance and criteria? Is there going to be a change in the testing criteria that will apply for kids in schools, whether they get to go to school, whether they're sent home from school? And I just wanted to say on this meeting, if there are other people who have comments about this, if they want to put them in the chat to share their perspective. I see a couple of you on today who've shared emails with me this week raising this concern. I've put this to the Schools Reopening Task Force group, to the pediatric infectious disease and epidemiology teams who really have been very instrumental throughout the pandemic at looking at what are the guidelines that we have to follow and where's the interpretation for best practice. And I think your observations from your practice are really, really important to bring to that group, because otherwise it's an academic conversation as opposed to a real life conversation. So knowing what your experiences are is really important. So I just wanted to give a minute or two if anybody wanted to unmute to speak about what their experiences and what they're seeing, or if you want to throw something in the chat. But I definitely wanted, for those of you who have already reached out or who may have been thinking about this, that this conversation will be happening on Friday to sort of, again, touch base, reassess. It's a tricky thing because at the same time, presentation of COVID has not changed. And so in kids, what's cold could be a cold, but it also could be COVID. What's a GI illness could be a GI illness, but it also could be COVID. So the problem is that piece hasn't changed. I think it's just the sheer numbers of cases and the numbers of tests that the practices are needing to do. So I don't know if anybody wants to unmute, if they want to add to that, or we'll move on to the vaccine discussion.
I think one of the things I would like clarification on is the deep PCR testing truly required? I actually called the school nurse today and was told that they encourage it, but it's not required, especially if the child is obviously very mildly ill and not feverish or anything like that. And if rapid antigen testing is acceptable in certain cases, is even seeing the provider required, or can they go to a drive-through and just get the test?
I can tell you from the conversation that happened a week ago at that same task force, or now it'll be almost 2 weeks ago at that same task force meeting, that the recommendation for community standards still is PCR and symptomatic kids as opposed to the rapid antigen testing. But there's a task force, a work group that's being established to really look at that more carefully in anticipation of all the screening that would happen next fall. I don't know that something will change in that space, Deb. The issue about deep NP versus a nary swab. I think what we have all been told throughout this is you do your best attempt, your best sample is the deeper NP, but recognizing with a lot of kids and even with some adults, it's difficult to get that. And so best attempt is what I have heard Brenda Ticini from Infection Prevention say. I know your personal situation with this. You shared with me some of the things that have happened. And that's why I really think the team needs to talk this through again. Like, are there mild modifications that we could in this that make it a little bit easier to continue to do good screening for our kids? We want the schools to continue to stay open. We want to be catching these cases, but boy, it's almost like a double standard for the community, right? Everybody can unmask, and yet, you're going to have this huge slew of kids with their runny noses, et cetera, who are having to have this, this swab. Kathy, do you have any thoughts about this? I'm not putting you on the spot, but I am kind of encouraging you to jump in. Kathy Hiltunen from the health department.
There's been no change to the prior guidance at this point, so you're absolutely right. The PCR is the gold standard. So where possible, you don't get the same number of false positives. And in fact, if you have a positive antigen, you can overturn it if you do PCR within 24 hours and it's negative. It doesn't work the other way around.
I think that a really careful look at the performance of the antigen testing and the PCR testing, and really looking at what we all know now after this full school year of screening all of these kids for this huge breadth of symptoms that we were given right from the very beginning. And there's a lot more information I think people know about presentation now. There's some work that's being done about prioritization of symptoms and how more likely certain symptoms are to be related to COVID. But I don't think anything's going to happen in the next 3 weeks before school lets out from this year to change the processes. But I promise to all of you, if you have other comments you want to share in an email or anything like that, please do. And for those of you who did reach out, I'll get back to you on Friday and let you know what the task force talked about and what the path forward is. And I think keep your observations and comments coming, because it really does. We do make sure that informs the conversation if you personally are not at the table for that. Okay. There's something in the chat, but I'm just looking. We've been hearing about the home testing kit. Kids. Schools will not accept results from home kits. They will not. I can say that one for sure. To Genesis Peds. Okay, and I appreciate that comment about nausea and the absence of other symptoms would be really nice. That's what I mean. It's like the whole kitchen sink of symptoms, right, that are on that list. So hopefully we'll get a little more clarification. So, all right, folks, thanks. So moving on from there to talk about vaccination. We have guests in the room, Kathy Hiltunen from the Health Department. I think I saw Joy, but I'm not sure if Joy is still on, pharmacist from the Health Department. Kim Povek and the work that she's doing, and I think Jackie Lytle was on also, who is helping to make some connections within the Finger Lakes counties. So I'm just going to turn it over to Kathy to start. I think it's really exciting the number of practices that have, since the last time we met 2 weeks ago, the number of practices who have now started to receive COVID vaccination and immunize. It's really remarkable. And just thanks again to English Road and Irondequoit Peds and Diego's group and Charlene Connors, the people who really kind of pioneered this, and we're all learning from you. But Kathy, do you want to take it over and talk a little bit about what's been happening? And I think what we want to do is see what else is needed for practices who may not be on board yet, what we can do to help.
Also, LJ, I want to introduce Elisa Orlando, who is a part of the Finger Lakes Hub team. She's joined us today too. She does a lot of our marketing and communications, and so she'll be a big part of this conversation as well. So Elisa, Jackie, thank you for joining us as well.
Thank you, Kim.
And thank you for inviting us to come. This has been a very exciting 2 weeks since the change of expanding the eligibility to the 12-year-old and up. We have had an outstanding response from pediatricians and family practitioners. We probably have close to 20 or more than 20. It's hard to keep up with who is vaccinating now, but we know that we've redistributed over 1,000 doses this week to primary care offices, and that's really, really good. I think that for me, that's the most exciting. But then on Friday, there was another exciting thing where they said we could give vaccination along with the other pediatric vaccines. We didn't have to wait 2 weeks. So I know in my immunization clinic where there was cheering in the halls, because when they come in for back to school mandated, we can say, and we have COVID along with HPV if you're, the other non-mandated ones, and we can do them at the same time up to whatever the mil limit is per kids. So that was really, really exciting. We also don't have a lack of vaccine anymore. 4 weeks ago, we were kind of short. We couldn't supply quite everyone as easily, and now we can. And in fact, we don't have to use it in 7 days. So an office can take vaccine and keep it until it reaches its expiration date. You still have to, when you pierce a vial, you have to use it that day or waste it. But the state has said responsible waste is okay if it gets more people vaccinated. So for example, in the adult population, you can use J&J, keep it in your refrigerator until its normal expiration date, and that's 5 doses a vial. Or you could use Moderna, which stays good in the refrigerator at least 30 days after we defrost it. If you have a vaccine compliant freezer, we can transport frozen state, and then you can just keep it in the freezer and defrost it as needed, which is kind of cool for Moderna. J&J is never frozen. There are even some offices that are exploring the ultra cold storage. I don't think that's, we're happy to store it on someone's behalf and then have it go into a regular freezer, vaccine freezer, but if they have ultra cold storage, we can do that too. So that's some of the new things that is allowing this expansion of primary cares to give it in their offices. There's a range of how they're doing it. Some are doing it as sort of a special clinic for their patients, and some are doing it throughout their practice. So if they have patients throughout the day that they're vaccinating for other purposes, they may incorporate COVID into that menu of choices for the patients. Some incredible practices are also vaccinating the parents while they're there with J&J. Wow, we didn't expect that. That's really cool. Those practices enroll those patients for 24 hours, give them the J&J, and disenroll once they upload to NICES. But that was a creative thing I would have never thought of. It's really cool. If folks want to ask questions, that's more meaningful than me just sort of blabbing. But so standing order. Okay, we use a non-patient specific standing order, just as we do for all of our pediatric vaccines. Yes, and adult vaccines. So within a practice, the doc can write a non-patient specific standing order. If they wanted to use Mendoza, we could talk about that, but yeah, it doesn't have to be patient specific unless it's off-label. What kinds of questions do people have?
Kathy, I'm wondering if
Yeah,
any of the, oh, no, I was wondering if any of the practices who have already been vaccinating or who have been training and getting ready to vaccinate want to just speak to that experience. Because I know some people have not officially started yet, but they've been working with you, Kathy, to kind of get up to speed in that process, because I think your experience may be very helpful to others on the call. We are aware, and I know that Doug Bennett could not be on this call today, but we're aware that Irondequoit Pediatrics was able to do, in addition to their normal workflows with patients, they were able to do a vaccine clinic and utilized the volunteers from United Way to be able to help with that. And so it's a nice model for how to enhance your staffing and expertise for one of these sessions. Penfield Peds, Deb, you guys are vaccinating 12 and up, but not parents. Any particular tips or points you want to offer to people on the call about how that's been going for you all?
We just started this week, so I think too early to tell. We set up a whole clinic yesterday and filled it somewhat, and then offered it to patients who were age eligible. And I don't know, 75% of the patients that were on my schedule yesterday who were age eligible had already done it through a public clinic. So I guess I'm a little concerned that we're not going to have a big demand for it. I don't know.
Kathy, do you have thoughts about that based on what you've seen in the adult population?
I think we're going to, in the next, starting last week through the next week or so, we're going to have the early adopter parents get their vaccines wherever they can, the quickest they can. So like in our community for the adults, the first 100, 150,000 were relatively easy. People wanted it. Now we're in the next phase of 100,000 adults, at least, that are hesitant and require a little bit more dialogue, and certainly are much more hesitant to take it from someone they don't know. And when we talk about what would make it easier, they do say if it was from someone they trusted, they'd be more open to doing it. So I'm thinking that's going to happen in the pediatric realm. Probably maybe half might get it quickly in one of the mass vacs, and then the other half of the patients, yes, I do pay my light bills. The other half of the patients may need that dialogue, or the parents will need the dialogue with a trusted professional like their primary care. I mean, who's going to be more trusted than that? But yeah, I would think the first half might go pretty quickly and might get vaccinated before the practices are vaccinating within their office.
Thanks, Kathy. There's a few questions that are coming up in the chat. I just want to remind folks, I think people are aware, but the ages we're talking about is age 12 and up at this point. We're not anticipating any expansion of the age range down to the younger kids until probably, it varies now what people say, right? Maybe the fall, but most likely not until late fall or early winter. We'll see what happens with that. And I think one of the questions that came up that was sent privately to me is how are practices managing the Visor specifically in their practices? Are they accepting much smaller allotments, or how are they doing that because of the shorter time allotment to be able to keep it refrigerated?
So some offices start very small. They might start with 1 vial of Visor for a week, and they pick the one day they're going to do those up to 6 vaccines. They see how that go, work out their processes, then ask for more. We are happy to reallocate down to the size of 1 vial. Often practices, once they've done that, are comfortable going up to, say, anywhere between 18 and 30 doses a week. And then the large practices have surprised us by being sometimes 100 or more in a week. And that's all Pfizer. We are happy to redistribute as often as needed so that we don't put into stress that 5-day, once it's defrosted, that has to be used in 5 days. And we're happy to ship it in a frozen state, well, not ship it, the practice picks it up in a container that maintains the frozen temperature so that it can go freezer to freezer. And then you've got an extra 2 weeks in the freezer plus 5 days defrost. So you can get 3 weeks worth of vaccine at once that way.
That's great information, Kathy. And for any practice that has refrigeration and freezers that are compliant for vaccines for children, those are all acceptable, right?
Mhm. Yep, as long
Because
as
they have
they
the
have a COVID
monitoring?
pin, no problem. And
Okay.
we're happy to work with offices, train them how to do the vaccine draw. It's a little bit more fragile than a typical pediatric vaccine. You can't flick it. We're kind of gentle with it because it's an mRNA model, so we don't want to break the strands. So we'll come out and meet, or we'll do training over the phone. We have a team that can come out. Whatever you need, we want to customize and provide you what you need.
One of the, Kathy, one of the biggest barriers that we're hearing from practices that have opted not to vaccinate in the practice is their nursing shortage, their staff crunch. So can we speak a little bit to what those resources are
Sure.
that could help a practice experiencing a staffing crunch?
I'm actually going to punt this to Kim Povic. If you notice in her face, she's ready to go.
Ready.
We thought for that. Kim, you're on.
Thanks, Kathy. So we've been working with the United Way, specifically Amber at the United Way, who's been wonderful to work with. They have over 2,000 volunteers. These are clinical folks, nurses, pharmacists, doctors, a lot of them who are retired, who are very seasoned, who are excited, who want to get out and vaccinate the community. We've learned, I talked to Amber yesterday, and these positions get opened, and by the end of the day, they're already filled. So people are filling these positions quickly. People want to get involved. And there's also a significant number who are willing to travel outside of Monroe County. So if you're a practice outside of Monroe County, staffing your clinics also should not be a problem. People are really excited to be able to use their skills and get involved. So if you're interested and you need some staff, you can reach out to me directly or reach out to Kathy or Renee, and they can get you to me to make that connection with Amber at the United Way.
Thanks, Kim. I just want to give a shout out to in the chat if people are not following along, different practices are reporting in that they'll be beginning soon. They're training up, Panorama Peds, Men in Pediatrics very soon, and 12 Corners, way to go. And 12 Corners has listed a couple of comments about the storage, again, reiterating that information. And then Mended Peds put a nice little tip in the chat about how they have formatted all of their vaccine and consent and pre-screening forms. So just something as a best practice that other practices could use. There was a question here about any updates on overnight camps, vaccination requirements, and masking guidance for day and overnight camps. So I was wondering if we could address that and then maybe talk a little bit about with having Jackie on the call and Kim helping with that conversation, what's happening for the outlying Finger Lakes counties outside of Monroe. So the camps first, maybe, Kathy, thoughts?
Yeah, I may not be the most up-to-date person. Camps are opening for the summer. I'm trying to pull up the CDC guidance that I just sent. Maybe I don't think it mentions camps.
Actually, Nadine just put in the chat, the governor literally did just put this out, so.
None of us are up to date, Kathy.
You guys know this is hot off the press, so.
Day camps are opening, and certainly the more we get vaccinated beforehand, the better. Some school settings are actually requiring vaccination. So the state and the government are not, but in secondary education, RIT is requiring vaccination. It wouldn't surprise me if other private entities may go that route as well, just because it makes things down the road a little simpler. But if they do that, they better supply the ability to do that for free for their constituents. Otherwise, I think there'll be a lot of tension. And I know all the secondary schools have done
Sources that are going into the chat too, if you want to look at that. But there is a question that came up before we talk about the Finger Lakes counties. Is the recommendation for COVID positive patients to still wait 90 days before receiving the vaccine?
They don't have to. That 90 days was presumed they had partial immunity and we had a vaccine shortage. We now know with the new variants that they may not have as much immunity as we'd hoped, And so we vaccinate on day 11. So if you are positive, if you have exited isolation at day 10, you can walk into any of our vaccination sites and we will vaccinate you the next day. Because the immune response looks to be actually more robust than having a mild case of the disease. And that may be because of the variants, we're not sure.
Thank you, Kathy. Kim and Jackie, I wonder if you want to speak a little bit to the Finger Lakes counties.
Sure. I'm Jackie Lytle. I'm with the S2AY Rural Health Network, and I work with the public health departments outside of Monroe County. So if you can touch base with anybody from Genesee down to Steuben and Chemung or over to Wayne County, I know all of the contacts, I know all the public health educators, but we're trying to take a page from the Monroe County playbook. All of the LHDs are anxious and want to have an opportunity to work with your offices to talk through how vaccine distribution might be possible through your offices. Our organization did a survey and it was quite clear. This next round of folks that are on the fence for getting a vaccine, they all need to hear from you folks. There's no amount of social media messaging that the LHDs are going to be able to do to address some of their questions. So we're really looking for that partnership. I know it's a little daunting when you're trying to figure out who do I talk to among 8 different county LHDs. That's where I come in. I can be the connector and make sure that we start walking through, okay, what's the deal? What are the first steps that we need to take? And figure out how we transport the vaccine to your offices, because we heard that was also a concern up front. And every LHD as of last Thursday said, if anyone is willing to take the vaccine, I'm willing to drive it and make sure they get it in their offices. So my contact information is available. I'll work with Kim around staffing if your offices need it, but definitely we're taking all of the learning that's happening in Monroe County, knowing that we want to see that happen in all of the rural counties as well outside of Monroe.
Thank you so much for that, Jackie. We really appreciate the work that you're doing and the work of the local health departments.
You got it.
I wanted to make sure we give time for Elisa to be able to offer additional information. So I'm turning it over to you.
Oh, thank you very much, everybody. I'm Elisa Orlando. I am the communications lead and the community engagement lead for the Finger Lakes COVID vaccine hub. And we're working with all 9 counties. We're working very closely with Kim and many of you to work in many arenas, attending to many audiences who may be thinking about the vaccine. So, one of our audiences is an audience of physicians. We are really working hard to encourage as many physicians as possible to sign up to become providers. And that's one of the reasons why I'm here today. We're hoping to do more work with AHP so that we can help physicians understand the work that Kim and her teams have been doing to remove any barriers that physicians may feel when it comes to providing vaccine. So we're going to be working on that in the future. As well, we have many resources that I put in the chat on the Vaccine Hub website. There is a really robust communications toolkit for any physician who needs information to give to their patients, coming from a variety of sources, all of which have been vetted by our community task force that you can use if you need anything that you need to say to your patients or anything that you may want to use in your own social media. I won't go through it with you, but the website has a lot of really good information on it, including a place where your patients can find vaccine at any time, and a place where we list all the vaccine clinics coming up. And every weekend, because we know people are getting out on the weekends now, every weekend we put on the front page where you can get a shot this weekend, just so that if you're out and about, you can stop by. It's really getting to that point now where people aren't looking so much for appointments anymore. As Chad pointed out earlier, you can pretty much get a vaccine anywhere. So we want to make sure they know where to go if they're going out. In addition, I want you to know that the Hub and Common Ground Health and the task force are working on a multi-level communications campaign that includes a media buy, which is in effect right now. It will include an additional media buy beginning in June for mass media, as well as social media, a public relations effort, and quite a number of printed and other kinds of materials that you will be able to use in your offices, or that you may be able to distribute to however you like. And that will be rolling out in the next couple of weeks, working with an ad agency called the Truth Collective. Our research and our empathy interviews that we conducted with Common Ground Health told us that people do trust physicians, specifically their primary care providers, and that people do not want to be persuaded. So our campaign is called Get the Facts Finger Lakes. You'll see that on the Hub webpage. We are only asking people to get the information that they need to make a decision about whether to get vaccinated. But we want to do that with intent and with emotion and with engagement that will encourage people to make the decision to get vaccinated. So all of those kinds of communication efforts are going on. So what I would say to you is, please avail yourself of the things that you need. Please get in touch with me if you need something and you don't see it on the website, because we can provide it for you. And finally, as we ask you to engage physicians, I think I saw Diego on the call, as Charlene and others have done, Charlene Connors and others of you have done, to become providers. Please encourage your peers to become providers, and if they can't vaccinate, to advocate with their patients to get vaccinated. I know that Jackie's working in some of the areas outside Monroe County. The health departments are going to engage with their physicians in their communities. So anything that you can do to help us help physicians either vaccinate or advocate, that would be great. And I'd be happy to work with you to meet your needs for that. I see some questions in the chat about transportation, and I know that vaccine transport's been an issue. And I see that also you're answering some questions. I just want to give a shout out to Kim for working so hard with her team to remove the barriers to vaccine for physicians, because it's been a really big help. So, and I want to just say thank you so much for those of you that are already doing so much to get people vaccinated or get people to decide to take the vaccine. Thank you so much from the Hub.
Thank you for your comments. I threw something up on the screen for everybody. I think the question about transportation is answered of how you transport the vaccine, and thank you to the county for piloting a courier service. It sounds like Mendon Peds got in there again. Last time it was pick me in the chat, and they got in there as the trial group again. Good work. And Jackie already spoke to the fact that the local health departments in the other counties are going to look to that. This is just a reminder. We will put this back in our email from today, but the post-vaccination guidelines for schools that was established back in January 2021, when we were vaccinating teachers and staff, applies for students. So keep in mind, our goal is so that if you have kids who have received the vaccine and are having symptoms related to that post-vaccination symptoms, as opposed to true COVID symptoms, this protocol will help you to tease that out. This has been re-released to all the schools again, because even though we have been vaccinating the older kids with the 12 to 15-year-old, now there's a lot more school nurses in the middle schools that are seeing kids who are coming and feeling kind of crappy after their, pardon me for the lack of a professional term, but feeling yucky after their vaccine. So I think with that, Chad, I'm turning it back to you and to Renee. I think we've covered everything. Thank you, everybody who joined from the Vaccine Hub in the counties. We really appreciate all of your work in supporting our practices.
Yes, thank you. Renee, anything from you?
Nothing from me.
All right. Kathy's turning her lights on, so we'll call it a day. So
If
thank you,
anybody
everybody.
needs help, I will come out to your office.
We'll get you a
and
clapper.
I'll show you how to do it. Anybody. I can do 2 a day. I used to say 2 a week. I'll do 2 a day.
That's amazing. All right, great work, everybody. Have a great day.
Thank you.
Thanks so much.
Take care. See you in 2
Bye.
weeks.